Yeah, hello. Oh my gosh, hi. Okay. I'm back again. That's the third time I've hit my hand trying to make this intro. So I'm back again because what the frickin' frick, I actually have time to do things. Yay. So this video is gonna be about my journey to top surgery. So, top surgery. For people who don't know, top surgery is one of the first surgeries that transgender people who are female to male have. So usually they do top surgery and or hysterectomy first. Yeah, so I, next week, June 8th, am finally having top surgery. But for this video, I kind of want to talk about how I got there and all like the red tape and whatever that I had to go through to get to where I am now. So, back in February of 2015, I started transitioning. So I came out to my friends, my family, and my school. Yeah. When I came out, the first step that I had to go through was therapy. So I went to a therapist for 6 months, after already being out for, I think, 3 months. So total span of time, I was 9 months identifying as male. So 6 of those 9 months, I was seeing a therapist, and I pretty much had to go to a therapist to make sure that I was, like, mentally sane, I guess, and that all the decisions that I was making were my decisions, and nobody was, like, pushing me to make these decisions. Pretty much making sure that I was, like, mentally fit to be able to make these decisions for myself, which is kind of, like, why it's my life. I should be able to do what I want, kind of thing. But pretty much to make sure that I was okay. So after 6 months of therapy, I got recommended to a hormone doctor. Not really a hormone doctor, more like a specialist who works with a lot of transgender patients. So I went and saw her way up in Saranac Lake. Her name is Dr. Kristen Frank Dixon. I went to her and pretty much was like, hi, my name is Hunter, I'm transgender, what do I do from here? So I told her that I wanted to do, go and start hormone therapy. So hormone therapy is pretty much, if you're female to male, you take testosterone, and if you are male to female, you start taking estrogen. So I told her that I wanted to start taking testosterone, and she went over all the different ways that I could do it. So the one that I picked was injections. I give myself an injection once every 2 weeks. It's called Depot Testosterone, and it's just in like a little vial. And I stick the needle in it, and I draw it up, and then I stab myself in the leg, and yeah. Once every 2 weeks. The other ways to do it are through pills. So there's actually like testosterone supplement pills that you can take, and there's another one that's a patch. So I decided to go with the injections because it's the quickest and like progression of transitioning. I think pills take the longest, and the patch is somewhere in the middle. My doctor also has worked with quite a few transgender men who they say that the shots have worked the best for them, so that's just what I decided to do. So when I started hormone therapy, I had to start checking in with my psychotherapist more often, and she always did things like keeping track of my anxiety levels, and I had to talk to her about like my triggers and what made me really angry, because there are a lot of mood swings that happen once being on testosterone, and I noticed that I was angry a lot more often at the littlest things, just because like my hormones were all over the place, and it's kind of like going through second puberty. So then I check in with my doctor once every 3 to 6 months, and I get blood work done. And they check all my levels and make sure that the testosterone in my bloodstream isn't too high, because that can cause problems on its own. And then also make sure it's not too low, so that I'm still progressing in my transition. I also checked in to give like updates of, you know, all the things that happen with transitioning. So like voice dropping, hair growth, muscle mass increase, appetite increase, the mood swings, and yeah, all of those things. So from there, I had to identify as male for a complete year before I could even go and talk to anybody about the thoughts of wanting to have top surgery. And through this entire year, I continued to go see a therapist just because they have to like keep doing psycho evaluations to make sure that I'm basically not insane. Being transgender is a mental diagnosis. It's kind of considered a mental illness, which is something for a whole nother video to talk about. So yeah, that's why I have to go see a psychotherapist. I don't currently see one, I have kind of gotten past that part. I did see somebody in Albany for a little while to get my letter for top surgery, but that's a little bit down the road. So after starting hormone therapy and seeing my therapist for the whole year cycle, I decided that I wanted to move on with top surgery. So pretty much what they do with top surgery is they remove whatever chest that you have. Obviously some people have a lot bigger chests, so their procedure is different, and then people with smaller chests have like a less invasive procedure. I have a small enough chest that I'm getting what's called peri. So what they're gonna do is they're gonna cut like around the nipple and then a donut hole around that on the outside, so it look like a donut. And then they remove the middle skin, and through that they pull everything. Well, this is really like vulgar, but they kind of like pull out all the extra tissue and stuff, and then they'll pull the outside skin in around the nipple like a drawstring bag. So I'm gonna have like really no visible scars, and then there are little incisions that they do on the side for drains that kind of just like drain any fluid that builds up from your body trying to heal itself. And in order for me to have even gone through and had this consultation, I had to get 2 letters. So my first letter came from my hormone doctor. She pretty much wrote a letter saying that I think top surgery would benefit Hunter immensely through his transition, and that I'm in a good mental state and I'm progressing well, and that I handled hormone therapy well, and that I pretty much am physically fit enough to move forward and get the surgery. From there, I had to go get a letter from another psychotherapist. The person I used to see, I was no longer seeing. So I had to go and find another therapist closer to where my college is. And I had to meet for him, and he had to do a psycho evaluation. I had so much paperwork I had to fill out, not just about me, but my home life, my schooling, my high school experiences, how long I've been presenting as male, how long I was on hormone therapy, and kind of why I wanted top surgery and what my goal was, like, in the end. So I had a bunch of paperwork that I fill out and a psycho evaluation, and then he had to do like another kind of in-person assessment. So I had to sit down and talk to him and answer all of his questions and talk about like my mood swings, how my home life has affected me, what kind of support system I have, or in some cases don't have. And he wrote me a letter based off of what he knew of me, the paperwork I filled out, and then the one-on-one that we had. And that letter was going to determine whether I could go and get a consultation or if I was out of luck. So luckily the letter that he wrote me was pretty much an overview of who I was, and that he thought that I was a perfect candidate for top surgery. So I had to send both of those letters over to my insurance company, and my insurance company had to go through a bunch of whatever it is that they do to actually get the surgery verified and decide if they were going to approve my surgery and pay for it, or if they weren't approving my surgery. And if they weren't, I would have had to pay $7,500. I think that's about what it's at. Thankfully, my insurance company did cover it, and because I had both, because I had 2 letters of recommendation instead of 1, my surgery is completely covered. So from there, I went and had a consultation with my doctor out in Oneonta, Dr. Thomas Huntsman. So he pretty much told me the surgery that he wanted to do, which is peri, which I explained, and kind of like the recovery process. After having the surgery and going into recovery, sometimes it can make people more dysphoric because they've lost a part of them. So he warned me about that and like how my mental state is gonna be. I can shower 2 days after my surgery, then I have to go back 7 days after having the surgery to get my drains removed, and to close up the incisions there, and yeah, then it's just basic post-op. I can't work from 3 to 4 weeks after my surgery because heavy lifting can like disconnect all the tissues and cause like it to heal awkwardly, and obviously I don't want that to happen. But yeah, after I get my drains removed, I'm back to regular activity. I recently had a consultation with Dr. Huntsman to actually set the date. So June 8th is when it's happening, and I'm going in and having surgery after all of this red tape and interviews and paperwork and making sure I'm mentally sane to be the person that I am. It's really disheartening when other people get to decide for you, because without those letters, no way that my surgery would have happened, and I would not have started hormone therapy. I wouldn't be the person I am now, and my mental state now compared to who I was years ago is immensely different. I hated everybody, like I've said before, hated myself, hated my family, didn't really have friends because I was so angry that other people got to be exactly how they felt and I just wasn't there, and nothing really made sense. and after transitioning and going through hormone therapy, and for my top surgery to be in a week is absolutely mind-blowing, and I've never been happier, and I've never been more comfortable in my body and with the person that I am. But in order to get there, to have all of these people like pretty much stopping you and saying, wait, you gotta fill this out, wait, we have to check to make sure you're not crazy, and all these things, like I understand there's precautions, but it was quite the battle, and it's hard to do if you don't have a really big support system. So my tidbit to all my trans friends out there, it's definitely worth it. Yeah, it's a really long journey, and like it's hard to get from point A to point B, but making it to the end, or at least like to your first surgery, is so relieving, because I never thought it would happen. I didn't ever think I'd be this happy, and that it would be this freeing, and that I'd be this confident. And doing it without a support system is definitely the hardest part. So I highly recommend looking in your area for transgender support groups or just general LGBTQ support groups, because obviously people in the community want to support others that are in the community. Finding that one really good friend who will be there at 2 a.m. when you're having a breakdown and you're freaking out, those people are always really important to have as well. Even if your biological family isn't there for you, you find people who become your family and support and love you through everything that you're going through. And I've been fortunate enough to have both my biological family and all of my friends that I consider family support and love me for the person that I am. Alright, so that's kind of it for today. I know that all my videos are super long, and I'm so sorry, but I just have a lot to talk about. If you guys have any questions about my surgery, want to know more information about how I got here, you can DM me on my Instagram. I will link my Instagram in the description. Yeah, thank you guys so much. Signing out.